I started off my career as a nurse and as a summer student worked in long-term care. And before I went into medicine, and that's where my passion comes around long-term care. Currently, I'd like to, I'm delighted Osteoporosis Canada is here. I've worked very strongly with Osteoporosis Canada for a number of years. I've served as their chair of their board and also the Scientific Advisory Council as their chair. And here at St. Peter's, the Jairus Research Center is very interested in preventing these painful fractures from happening. One of my colleagues, Dr. Richard Crilly at Western, has said, how old do you have to be before a fracture doesn't hurt? And I think that as part of the Ministry of Health has funded the Ontario Osteoporosis Long-Term Care Strategy to reduce those painful fractures, prevent transfer and ending your life in an acute care hospital after breaking a hip. That really is our goal, that we don't want people to die from a hip fracture. We want them to be in their home to keep comfortable and pain-free. Long-term care is their home. Acute care in the hospital often is challenged with frail older adults, especially those with memory problems or dementia. And so I noticed people mentioning that their parent may have dementia and osteoporosis. Those two go often very hand in hand. Some of our research in Ontario recently has shown that the first 3 months of being admitted to long-term care is the highest risk time to break your hip. In order to solve this problem, we need to target the osteoporosis treatment, and we also need to target reducing falls. We've just, with the Canadian Institute of Health Research and the Ontario Osteoporosis Strategy, as well as the Ontario College of Family Physicians and the Ontario Long-Term Care Family Physicians, led an initiative to make recommendations to long-term care to try and address this issue. Because we know that with current research, we can reduce painful fractures from happening by 40 to 60%, which is pretty big. We could reduce the number of people from long-term care that show up in the last 3 months of their lives in the hospital, where they die often, very uncomfortable. So that really is the goal. And we know people with dementia deal better with their dementia if they're able to walk around rather than be in a wheelchair with a broken hip. So what can long-term care homes do? And what can families do? First of all, number one, my interest is that this is, osteoporosis and fractures are 40% is genetic. So I had a grandmother who had severe osteoporosis. She didn't break her hip, but she was very curved. So she walked like this. And a lot of people think that's normal aging. It's often related to fractures in your back from osteoporosis. And individuals in long-term care who have broken bones in their back will sometimes get agitated and given the wrong type of medications to control the agitation because they're in pain. The other more common fracture as well is that people fall and break their hip. But the spine fractures are actually the most common. About 40% of people, those older women in long-term care, have a number of spine fractures. They're quite painful and often missed, and antipsychotics are used instead. So tip number one is when your loved one is being admitted to long-term care, is asking, have they had a fracture in the past 10 to 15 years? because those individuals need to be on treatment to prevent the next fracture from happening. We know it's going to happen. Vitamin D and calcium in the high-risk individuals who have had a fracture can reduce the risk of falls and fractures. So that information is between 800 to 2,000 of vitamin D. And seniors that are often in long-term care have very low vitamin D levels, and their muscles can become painful or uncomfortable. And vitamin D is about $20 a year. It's a very cheap option with very few side effects. So we are recommending that long-term care homes establish these practices. And I think families who are more informed and residents who are more informed can advocate for the best care. Now, folks will often say to me, especially physicians, our residents are on so many drugs, you're asking me to start more drugs. And I'll often say, when I look at the medication, that they're drugs that we can stop, that there are things that can be discontinued and reviewed. Because that's my area of expertise, is working with older individuals. The other things that we know, as we've talked about, there are a number of medications by mouth, through a needle twice a year, or once a year through an intravenous. So if taking a pill is a challenge, there are other options. The drugs you need work very quickly within a year to reduce your chances of breaking something. Now, and those options are covered by the government for seniors. So having that discussion with the nurse, with the pharmacist, can often bring the physician on board, because it's a team in long-term care. And so engage your healthcare team if you can't directly access your physician to advocate for your parent or for yourself. We know from the hospital we could do a better job of starting treatment on patients. We often send them home, and we could do better initiating treatment after a fracture. In terms of falls, I know people were talking about physiotherapy. We know people who are high risk, just walking actually may increase the risk of breaking something. So people who are high risk, when I say high risk, who have broken a bone before, the physiotherapist needs to focus on balance and resistance training. And even though you may be very frail, or your parent be very frail, nutrition and that targeted exercise of balance and resistance training is really important. The other things that reduce falls is reviewing the medication somebody's on. We know that certain drugs for depression that control behavior with dementia can also increase your risk of breaking something. And as dementia changes over the time you have the disease, you may not need that dose of medication, or you may not need that medication anymore. So individuals change as the disease changes. So you may have, your parent or you may have come into long-term care with certain drugs, but that can change. The bottom line we want to share is that we can reduce the chance of breaking something, prevent the pain, and improve the quality of life for residents in long-term care in Ontario. Men in long-term care, when they break their hip, their risk of dying is very high. It's double that of the women in long-term care. So in those individuals, men in their younger years aren't as affected by osteoporosis, but when they get older and they're in long-term care, they're breaking their hip, they're breaking their bones in their back. So they're a group that we really need to, it's not a woman's disease in long-term care. So we need to target those individuals, assess them. Are they at high risk? Is there some treatment? And we're going to come up with recommendations and a plan that will help long-term care implement these recommendations, or have the discussion with family and residents. And in terms of the genetic, if your parent has had a fracture, you're at much higher risk. And it's regardless if it's your mother or your father. And this is really, sometimes I'll see 3 generations in my office, where it's the great-grandchild, grandchild, actually 4. The daughter, and then the mother, and from the little ones to the older person who's had the fracture, they're all at risk and can do things differently in their life. We know a lot of kids are not getting adequate calcium through their diet to build their bones. And that's really important, to build your bones when you're younger. So it really affects your whole family when a parent or grandparent has osteoporosis. So in terms of hip protectors, the government at this time does not cover them in Ontario, so as families you need to purchase them. Some insurance plans will cover them. They do work. There's different types. There's different types for people who have continence issues, have to go to the bathroom frequently. I think that there's concern. A lot of healthcare providers haven't even seen what a hip protector looks like. They do work if the resident will wear them. And there's many that are, there's some that were bulkier, the first generation. Now some are, they look like a little bit like hockey shorts or biking pants. But there are a number of different models, and often the local pharmacy you can go in and see what the different models look like. Well, some of the homes will buy them and have an arrangement with certain companies where they can get a much better price, or with, so they can range from $40 to $100. And most individuals need 2 to 3 because of just the laundry. We've done a lot of work with nurses here in Hamilton at Shalom, and they were quite keen to use them, and other homes here in Hamilton, if the individual is falling frequently. But your parent really has to want to wear them. And some people, sometimes some people are concerned, believe it or not, at any age, that the hip protectors will make them look chubbier than they are. I've had that from 95-year-olds. So if somebody has a really curved back, and you think that they may have had fractures in their spine, sitting or standing for any long time will make them agitated. So if your parent or a resident has a fracture, sitting more than 20 minutes in one position will be very uncomfortable for them. The other thing, when your back is quite curved, it will put pressure points on the different parts of your back if you're leaning back on a chair. So number one, frequent position changes are important, and that is challenging if people are sitting up in a wheelchair for a couple of hours. That individual will get agitated. And that is really important to sit and talk with your pharmacist. Also in the long-term care is part of the team, talking to the pharmacist and the nurse and saying, what are the treatment options to keep them comfortable? If they've had a fracture, you want to prevent them progressing, because that'll make the fracture much worse and the pain worse. And the medication for osteoporosis can help prevent that from happening. And there is really a lot of initiatives right now to try and help residents and families advocate for better pain control. There's no question, everybody who has seen even a child break their arm or fall out of a tree, it hurts to break your bone. When you break your hip, you have to go to hospital, so everybody knows you've had a hip fracture. When you break your bone in your spine, it's often missed. because the first sign may be just that your mom has lost 4 inches of height, or your dad. They might have been taller than you, and people will say all of a sudden, "Boy, that's funny, you're shorter than me all of a sudden." And that may be the first sign. And until you have a number of these fractures, it may not be picked up by the healthcare team. So they're frequently missed, but can cause a lot of pain and discomfort. So sometimes people will have chronic back problems. They've been managing with a bit of Tylenol, but then the fracture just tips them over. And people don't think to x-ray the back. I think Sid Feldman, who is a family physician at Baycrest and a real leader in Ontario in primary care and care of seniors, has said a hip fracture is the game changer in your life. It changes everything. Even with rehabilitation, we know that 50% of people will never be the same, or have to go to long-term care when they may have not been ready for it. Or, as somebody mentioned, when you're in long-term care and you break your hip, about 50% of those individuals are going to die within a year. It's a pretty life-changing event. So osteoporosis and its consequences are not a normal part of aging. So I hope in the next generation, people don't think having a curved back and losing 4 inches, I should say this in centimeters, is a normal part of aging. We know we can prevent that. We know we can change the course of people's lives by often research that's been available for a number of years. What we do, and here's my plug for geriatric specialty, is we look at the whole person. We don't look at people as an organ, the heart. Not that my colleagues do that, but that's, we have recommended that those really at high risk need vitamin D, and those who are, everybody who has not had a fracture before or doesn't have osteoporosis, there is good research that it's very helpful in, especially in the long-term care population. They can't get out to absorb the vitamin D from the sun. Because vitamin D has a lot of places it connects. It connects to the bone, it connects to the immune system. There's been a lot of research is, can it prevent cancer? Can it prevent immune disease? We do know that it affects the muscle receptors, and it affects your balance and your sway. So it can, that's how we think one of the reasons may be that it prevents the falls from happening. We know that it works hand in hand with your calcium, ideally from your diet, but some people may need a supplement. The calcium and vitamin D is helpful also in maintaining the bone. I think that that's really key, is that you as the baby boomers can advocate for your parent and change in long-term care. But to truly reduce fractures in individuals who are high risk, and high risk we mean again, those who have had a fracture, you really often need the whole package. You need calcium from your diet, the vitamin D, medication, and also looking at resistance and balance training. Plus or minus maybe hip protectors if somebody is wandering and their judgment is a little impaired. So the medications for osteoporosis, there are some, no matter what age you are, the cells, the bone is a living tissue, and the cells are breaking down the bone faster than they're building. And so these medications stop preventing that really fast breakdown of bone. So our bones are really strong, living tissues, and with osteoporosis, they become like lace. So when your bones are strong and hard, like this pen, when it falls, it's not going to break. But when your bones look like lace, they really break quickly. And so within a year, hip fractures are reduced by 40%, spine fractures by 40 to 60%. because it prevents that accelerated bone loss. And there are some medications to build bones as well that are available. Somebody who has dementia is at much higher risk of falling. Dementia affects your balance centers, and you do lean forward and tend to fall, and your center of gravity shifts. So looking, and it was really a red flag for us, a warning signal. So I want you to bend your knees and lean forward. And think about what do you feel like you're gonna do?
Tip over.
Tip over.
I'm not sure I can walk.
And try and walk. What's your steps like, Mary Lou? Let's see.
They're very, like, I gotta really think, and I feel off balance when I lift a foot up.
So that is what osteoporosis of spine fractures does to you. And what happens after a while is that your muscles in your legs start shaking. Your back starts hurting.
Atrophy.
Yeah. And you get headaches. So people will say, well, why does she have a headache? Well, just imagine if you're like this, your body, your head your muscles in your back want to pull you upright. So they're constantly tense. So that's what it feels like. That's what it does. And when you're at the world at this point, looking at this point, as another colleague said, can you imagine that this floor is what you see all the time? That's what you see. You don't see what's in front of you.